Okay, we're going to tell you about neonatal abstinence syndrome, and we just want to bring this to your attention so that you're aware of this disease and you can possibly help us spread the word. So NAS is a group of problems that occur in a baby who is exposed to certain drugs while in the mother's womb. Every drug taken while you're pregnant can get passed to your baby when they're born. Certain drugs can cause NAS, and once they're born, they're not getting those drugs anymore, so then they start going through withdrawal symptoms.
Okay, so we're going to talk about several different classes of drugs that can cause these withdrawal symptoms. And a lot of these drugs are drugs that get introduced during adolescence and your young adult years. So the first one that we're going to talk about are narcotics. And some examples of narcotics are methadone, heroin, morphine, fentanyl, oxycodone, hydrocodone or Loratab, oxymorphone, hydromorphone or Dilaudid, codeine, Subutex, and Suboxone. Withdrawal symptoms from these types of drugs can last for up to 6 months, and symptoms can include high risk for seizures for babies and sudden infant death syndrome, also known as SIDS. The second group of drugs that we're going to talk about are antidepressants. Some examples of antidepressants are Zoloft, Paxil, Prozac, Celexa, and Cipralex. The withdrawal symptoms of these drugs for using them while you're pregnant is that the baby can have lung problems. The next group of drugs that we're going to talk about are benzodiazepines. Examples of these would be Xanax, Klonopin, Valium or diazepam, and lorazepam or Ativan. The withdrawal symptoms for these can occur within days or weeks after birth, and the symptoms can include premature birth, low birth weight, breathing problems, low blood sugar, or even floppy infant syndrome, which is like a lack of muscle tone for the babies. The next group of drugs that we're going to talk about are street drugs, and these can include cocaine, marijuana, and methamphetamines. The risk factors for cocaine are an increased risk of SIDS, or the mom will be at risk for placental abruption, which means that before the baby is born, oxygen and nutrients are cut off to the baby, so that could cause risk for death for the baby. Marijuana, the risk factors is that the baby could be low birth weight. And methamphetamines or inhalants or PCP drugs, the baby's at risk for preterm labor, severe withdrawal symptoms, and the mom is at risk to miscarry the baby. The last drug that we're going to talk about are cigarettes. For moms who smoke during their pregnancy, their baby is at risk for low birth weight, fetal demise or a stillborn baby, prematurity, and SIDS, the sudden infant death syndrome. Symptoms for these babies, it really varies and depends on the type and the amount and the duration and the number of drugs used during the pregnancy. Each baby also varies in how it breaks down these drugs and how quickly it can get the drug out of its system.
I have the Finnegan scoring tool, and this helps score babies on signs and symptoms of withdrawal that they may have. Some things are scored higher than others, and I'm just going to tell you a little bit about some signs and symptoms that babies can have that are due to withdrawals and what the parents and caregivers can do about it. Okay, the first one is an excessive high-pitched cry or a continuous high-pitched cry. And what is this? The withdrawal can sometimes be uncomfortable and painful and make the baby irritable. The parents and caregivers can try to soothe the baby by swallowing the baby, holding it really close to them, or offering it a pacifier. And this is scored pretty high because this is something that is common in these babies. The next thing is sleeping. Sleeping less than 1 hour scores high. Sleeping less than 2 hours scores a little higher, and then sleeping less than 3 hours scores a little bit lower. Withdrawal symptoms can make your baby uncomfortable and makes it hard for them to sleep. And then things you can do about this is offer your baby a pacifier. And the big thing is if your baby is asleep when you get to the bedside, let the baby sleep until the baby wakes up to eat. So do not wake up the baby. The next thing is the Moro reflex, and this is a normal reflex for newborn babies. Babies experiencing withdrawal have central nervous systems that can cause extra abnormal movements after the Moro reflex. And what you can do for your baby with this is approach your baby quietly, don't speak loudly, and use a gentle firm pressure when touching your baby. The next thing are tremors. This is also scored highly if the tremors are severe. And obviously some babies do have tremors, so it can't be completely accurate, but if they're really bad tremors, then the nurses can be aware that this is due to NAS. And things you can do for this is keep your baby swaddled and always use a gentle but firm pressure again when touching your baby. The next one is increased muscle tone. And withdrawal can make the babies stiff and hard to bend their arms and legs. And what parents and caregivers do is be aware that this will go away after your baby goes home. Be gentle when changing diapers, and then a physical therapist may be consulted to help you and your baby relax. Okay. And then another thing is myoclonic jerks, which are twitching or jerking of the arms and legs. And then babies experiencing withdrawal can have very sensitive central nervous systems, which can easily be stimulated by touch and or sound. And what you can do is do not wake the baby unless it's time to eat. And in that one, it says that you can wake the baby, but if they're sleeping less than 1 hour, once again, you do not wake the baby to eat. You let the baby wake up before you. Okay. Another one is generalized convulsions or seizures, and this is scored quite highly on this tool. This gives a score of 5, which is one of the higher things on this tool, and this is rare, but this is a very serious symptom of drug withdrawal. And then the parents and caregivers, if the baby has seizure medication, they just need to be aware of how to give the medication and just be taught on that. Another thing can be sweating. This is scored quite low because obviously some babies are going to sweat, whether they're withdrawal babies or not. But the big thing with this is just do not let your baby get overheated. And the next thing is increased temperature, hypothermia. Greater than 100.9 scores 2, 99 to 100.9 scores 1. And then the same thing, your baby may get Tylenol to decrease the temperature, but just make sure that they're not laying with a bunch of blankets on them, keep them in black clothing. Another thing is frequent yawning. This also scores a 1. And babies normally do not yawn a lot, so this would be something that would be different for an NAS baby. And there's really nothing to do about it. This just improves as the withdrawal symptoms subside. Modeling is the next one, and that's just a discoloration of the skin, especially on the baby's chest, trunk, arms, and legs. And this also will just go away. Nasal stuffing this, and this, some babies may get stuffy nose, but this can be helped with frequent suctioning of the nose. Next is sneezing, and it's not normal for a baby to sneeze. If a baby is withdrawing and sneezes greater than 3 times during the scoring interval, it does not mean your baby is sick. Sneezing is a sign of withdrawal. And this also just goes away, and this is something parents need to be aware of and let the nurse know if the baby does sneeze. And then the last thing that I have, and in case he has a few more, would be nasal flaring. It may be harder for these babies to breathe normal when they are withdrawing. One of their signs is their nostrils flare whenever they breathe. And things you can do for this are holding the baby upright, make sure the baby is breathing easy, and make sure the head of the crib is elevated when your baby's lying in the crib.
Some more symptoms that your baby can have would be breathing fast, which is a sign of withdrawal. So if they're breathing greater than 60 times per minute, or if you can see their ribs moving whenever they're breathing, that's probably not a good sign, and you want to try and keep them calm and just hold them and try and calm them down. They can also have excessive sucking. So again, you just want to try and calm your baby, and when you're feeding them, try not to let them go too fast. They can also have poor feeding, so you don't want to stimulate your baby or rock them while you're feeding them so that they can focus on that one task. They can throw up a lot while they are getting fed, so you need to be sure to slow them down and not let them eat too fast. Then they can also have a lot of diarrhea, loose, watery stools. So you want to be gentle when you're changing diapers, use soothing wipes, and use protection on their bottom. And the way that these symptoms get scored is with the Finnegan scoring tool. And they, depending on their starting dose, they'll get a dose of morphine, and it depends on how much their symptoms are, and then they'll start with 40 micrograms of morphine, and if it's a higher score, then they'll go up to 200. And then they can start to wean after their scores are less than 9 for 48 hours. So the best way to prevent NAS is to, if you are taking drugs, you need to remain abstinent or be taking birth control. But if you do get pregnant while you're taking drugs, you need to talk to your doctor before you stop taking any drugs completely, because they need to help you start weaning off of them.
We went and talked to a specialist at Children's Hospital, and her name is Patty Zetterberg, and she told us about later effects that NAS has on your baby after they leave the NICU and what you can do for your baby. And a big thing that she talked about is your baby can't go home until all their withdrawal and withdrawal meds have stopped. And then once they do go home, they'll get visits from nurses, social workers, and therapists every 3 to 4 months for their first 1 to 2 years of life. And to remember that even though they just came home from the hospital, they still need to keep going back for their well baby appointments. And if your baby is fussy at home, some things that you can help do for your baby is keep the room quiet and dim. Because the babies are used to being in the womb and they're in a controlled environment where it is quiet and it is dark, and now that they are born, they're not used to the light and the noise and everything, so you can just take them in a dark room, turn the TV off, and do things like that. They like to be swaddled tightly because, once again, they're used to being in a tight space in the womb. And another thing that you can do is to hold your babies during feedings, but when they're done, be sure to put them down so they can get used to being alone by themselves. And a big thing, if they are non-consolable, to call your doctor because something could actually be wrong with them. The 4 main problems that Ms. Zetterberg talked to us about were sensory problems, having ADHD when they get older, sleep regulation, and then behavior and emotional regulation. For sensory problems, these problems are dealt with in the frontal and temporal lobe. And in the frontal lobe, it regulates decision-making, problem-solving, and it controls behaviors and emotions. And then in the temporal lobe, it does things like it's involved in retention and memories, processing sensory input, comprehending language, and storing new memories and emotions. And things like this can happen to your baby, causing them not to want tummy time, which is good for your baby because it helps them learn how to control their head, and it'll learn how to turn side to side. But since they don't like tummy time, it'll take them longer to pick their head up, longer to sit, and longer to stand. Your child will also be fussy and irritable and will need occupational therapy. And then many children who act like this can be mistaken for autism, so don't just assume they need to go to the doctor and be tested for this. The ADHD part, many children, their ADHD will be so severe that they will need medications. So if you start seeing something wrong with your children about how they can't sleep, they run around all the time, you probably need to take them to the doctor and see if they need any medications such as Ritalin. And then the sleep regulation, this is also controlled in the frontal and temporal lobe as well. And the children won't want to nap because they can't slow down, and because they don't nap, they'll go to bed earlier, but because they go to bed earlier, they'll wake up earlier. And this just causes problems all around for the child because they'll be up at random times and they sleep at random times, and that can put a strain on the family. And if you feel like you need something to help your child, go to the doctor, and they may prescribe melatonin first, but if that doesn't work, then they can try clonidine. But never ever give your children sleeping pills. Then the behavioral and emotion regulation portion. This is also controlled in the frontal and temporal lobe. Your child will not have any impulse control and will be very fussy and have a very bad temper. But it's best if you leave them alone and let them try to work it out themselves, because trying to help them and telling them to calm down or be quiet can make the situation worse and make them more angry. And if you feel like this is becoming a problem, you can take them to the doctor and they'll get psychotropic meds given to them. And this, these are Ritalin, which is a short-acting drug which lasts for 3 to 4 hours, or they can be prescribed Ritalin LA, which is a long-acting drug, and it lasts 8 to 12 hours. And this drug will treat impulse and ADHD, and some side effects of this that you can watch out for are loss of appetite, they can't sleep, and they'll be irritable.
And that's all we have.